Hey, how you doing? My name is Dr. Richie Cole, Radical Counseling and Consultation. Hopefully you guys have been watching some of these episodes covering different things. A lot of the initial focus had been on my own form of therapy that I call mind construction, and that's still happening, but also intermittently I'm answering certain questions that come in on emails, and I'm still going to do that. But as some of you guys had seen, there was a prior episode with my colleague, registered associate marriage and family therapist, John Carroll, and we discuss cases and chop it up and kind of share information. So John was willing to record this, and he had a case or a hypothetical case or whatever, and he kind of had some questions and wanted to get my feedback, and he'll put in his 2 cents as it pertains to how to utilize mind construction with the symptoms or the case that he wants to bring up. So I don't know anything about this case per se, and I didn't really want him to review the questions with me because I'd rather just shoot from the hip. So please understand, this is never a comprehensive, exhaustive list of responses of what to do. It's just 2 mental health professionals passing information, consulting about a case, whether real or hypothetical. Of course, we would always make sure to maintain the person's confidentiality by switching some information, not providing any real identifying information and stuff like that. So you've got to take that into consideration because everybody deserves privacy, and there's federal laws of HIPAA and state laws of confidentiality. So just take that into consideration. But good to see you, John. Thank you for making it today. How are you doing, bro?
I'm good. Thank you, Dr. Richie, and I appreciate you taking the time to do this. I kind of want to focus on one of my hypothetical clients that I foresee working with in the future. And it's a scenario. The scenario that we'll look at, I guess you could say, would be a college athlete who has tested positive for the second time, which is in violation of the NCAA rules and regulations. So initially he tested positive for, they break it down into performance enhancing drugs or PEDs, and what the other type of drug that they would test for, they label it as a street drug. So that could be anything that would be illegally
illicit drug.
Yeah, it would be illicit drug. So in the case of the client that I would like to discuss, this is his second time. So this is his first time he was suspended for 6 months. And the second time it's going to be a whole year. And it was for a street drug. He tested positive. He's a regular marijuana user.
Yeah.
And he uses it primarily it's a good way for him to kind of regulate himself and kind of calm himself. Now, he doesn't have a license for it. He's only a sophomore in college. He plays at one of the local colleges here in Los Angeles area. And the first time, what the situation is, after the first time that he tested positive, he was able to stay with the team, practice, go through all the regular day-to-day kind of operational things that they do for the team. The only thing he couldn't do was play in the games. He was able to play this last year, and it was during the off season over his Christmas break where he came back and they did random drug testing. And because he had already tested positive once, he was brought up and he tested positive again for marijuana, which against NCAA rules up to this date in 2022, it is still seen as a legal street drug.
Well, let me say this real quick, bro.
Sure.
Just for the audience's benefit. One of the things is, I don't know how much they know about your history, but John has been a football coach and an educator for over 20 years. And when he got interested in studying psychology and wanting to become a licensed psychotherapist, a part of his motivation was wanting to work with athletes because even his father was a coach. And so part of John's DNA has to do with being an athlete and being a coach. And so, of course, for me, this is something that I don't have an expertise in, but from the first time that I met John, we've been talking about this because every different mental health professional ends up kind of getting their own niche and utilizing their services in a unique area. And so I just wanted to kind of put that background there that John, always wanted to work with people in sports. And the other thing is John and I have worked together with addicts, and there's a percentage of people who become drug addicts that actually were athletes, and a lot of times amateur, and they were hoping to make it to college and or pro, and maybe they got an injury and then were given analgesics, pain medication, and then developed an addiction, or they didn't make it as high as they wanted to be and they really didn't have a plan B, or their motivation level was so low they ended up getting involved with drugs, any type of drug, and then developed a problem with a substance use disorder, substance dependence, or addiction. So it's really one of those things. And we know a lot of the major cause of death for adults from 18 to like 45 right now is overdoses, and a tremendous amount of those overdoses are due to fentanyl, and you guys have probably heard this in the media. So it's a huge social problem, and it's a real concern. Now, what this reminds me of a little bit in terms of how it relates to the work that I do above and beyond working with addicts, John, is that I'm a qualified United States Department of Transportation substance abuse professional. So what happens is there's different fields. Say, for example, truck drivers. There's like 12 million truck drivers in the United States. Because of the federal laws under the United States Department of Transportation, if they test positive during a pre-employment or a random or a suspicion or post-accident test, they have to then be evaluated. They have to stand down. They're not allowed to work in what's called safety sensitive duties. They have to come to a substance abuse professional like myself to be evaluated. And that person is considered an employee rather than a client of mine, because the client is the traveling public and the safety of society. But I would do an evaluation and determine the treatment and education they need, send them to different professionals to get that education, to get that treatment. Sometimes it includes psychotherapy and meetings and education with addiction specialists. And then they call me up when they've done everything and say, I want to come in for my follow-up evaluation. And so they show that they complied, and that allows them to stay in their profession working in safety sensitive duties. So even though I don't really have a history of working with athletes, there is that parallel of working with people whose careers get put on hold or there's an intervention because of illicit substance use or even alcohol or marijuana. Now, the feds do not recognize recreational nor medical marijuana. So you get a lot of that in California, that truck drivers either don't realize or just throw caution to the wind, that you cannot be a truck driver or somebody who works in safety sensitive duties and be using marijuana, because of the fact marijuana stays in your system so long. Even though you might not be under the influence if you smoked it 3 weeks ago, if you come up for a random alcohol or drug test and you test positive for marijuana, even though you might not be under the influence at that point, you still have to stand down and go through the return to duty process. So I'm kind of familiar with that. And sometimes people will talk about how, well, it's only marijuana and it's legal and it's not fair. And just like when my kids were growing up, when they'd say, Dad, this isn't fair, life's not fair, it is what it is. Knowing the stipulations, knowing the rules, knowing the ramifications is good information, because we all have choices to make, and we want to try to think about the potential consequences or outcomes in the decisions we make to be able to get the best outcomes. And so this is when it relates back to the DRAP model. You know that the DRAP model has behavior, thoughts, feelings, and core beliefs. And the number one order of business is learning how to act right, or acting in a way that's going to yield positive or non-negative outcomes. And so this young man already getting busted once, he already obviously knows he can't smoke marijuana and be in good standing on the team. And so, boom, that's what he did, right? So just to
Yes.
pull it back and give the viewers kind of like the bigger picture and an understanding of what type of work you've always been interested in doing. So bringing it back to you, where are you at with this right now? What are your thoughts and how to proceed, and how can I be of service to you?
Well, kind of to do a little bit of background on him, so you have better understanding. After his first one, the university sent him to a rehab facility, and that's where I had my first contact with him. He was doing a 30-day, 24 to 30-day stint in a residential treatment center in the greater Los Angeles area. And so, because I am active in my own recovery, I've been 10 years of sobriety, and that's how our paths crossed. So that was my initial meeting with him.
So
And
you went there like on an H&I panel or something?
I went there on an H&I panel, yes, because
Mhm.
I did the 10-minute speaker. And so
That's cool.
it was a speaker meeting, and I did the first 10 minutes before the speaker was in. But he went through MA, and I know there wasn't that many meetings, but he went through the whole process, and then he went back to his environment, which was obviously he was living on campus, and so he was able to stay sober. I would like to say probably about 6 to 7 months. And then, because even during that time, they were testing him randomly. And so, after the 7-month period, when he came back from Christmas break is when he got popped again. So this time it's a year. And this is where my question is. He has gone through the regular kind of the generic recovery where he would go to processing. He did the he did the RTC, he went to meetings, and it still wasn't enough to keep him from abstaining from using. And so I think this is a good situation for me to introduce the DRAT, or the mind construction, to him. And my first question, I guess I would ask you is, how would you introduce it to him? Because he's not new to the game. He's been through this, so he understands, well, I'm going to have to go back to meetings. I'm going to have to do this and that. I would like to take a different approach with them this time around, and see if the mind construction can work for a guy like this.
That's really cool, John. One thing we realize with people who struggle with substance use disorders is that there's the different stages of change. And there's the pre-contemplative stage of change where someone's in denial and don't feel they have a problem. There's the contemplative stage of change where they're thinking, maybe I do have an issue with this. Then they go into the preparation or determination stage of change when they make a decision to, implement some action. And then they go to the action stage of change where they put forth the effort, energy, and whatever's required to get and stay clean and sober. And then it goes into the maintenance stage. The only thing that will interrupt the maintenance stage is what's relapse, which is falling back into the problematic behavior in question. So with a substance like marijuana, now, is there any other substances that he is dependent upon or uses besides marijuana that you know of?
Not that I know of. And from the test, it just came back. The only drug that was found, he wasn't using performance enhancing drugs. It was just marijuana that was found. The
Because
other
one
thing
thing that I would want to know is,
Yes.
are there any other, first of all, coming from a non-judgmental perspective with him, and a lot of times we talk about using motivational interviewing strategies or techniques, which is, hey, you're going to do what you're going to do, but I want to be a source of support. And so we can look at some things and weigh the pros and cons. We've talked about the behavioral analysis quadrant, where you're looking at the benefits of engaging in the behavior in question, and you're looking at what would be the downsides of discontinuing it, and what would be the, downsides of discontinuing it, and then what would be the upside of discontinuing the behavior in question. And they can kind of make a list, and we'll have Odette put that behavioral analysis quadrant in this thing for the YouTube channel on the Facebook thing. But one thing I would really want to know is, because say like this other client that you and I have been discussing that has been using cocaine intermittently,
Right.
as long as he doesn't drink alcohol, he's not that inclined to go get coke. And most of us who have been addicts and alcoholics know that if you have some level of an issue with cocaine, it happens to come up once you're disinhibited due to alcohol consumption, because our judgment is impaired. And that's really where you're like, yeah, let me go get some blow. Right. And then of course, later the regret, the shame. So now I don't see that as much with marijuana, to where someone is under the influence of alcohol and says, man, let me just get stoned. There's a lot of excuses, justifications, or things that tend to seem to be the catalyst of, man, someone handed me a joint, or whatever the case it is. But one of the things is going to be knowledge. Now, most people understand that when you use marijuana in pretty much any form, it stays in your system at least 3 weeks to a month, but it could be several months. So of all the different substances, even though people might not consider marijuana highly dangerous, and that's a whole nother debatable separate issue, because it's, there's a lot of different perspectives, physiologically, politically, just other ways to see the marijuana issue. But because it stays in your system so long, it's the one substance that, if there is a prohibition on using substances, that's not the one to use. Because really, you could drink alcohol. If you're not an alcoholic and you're a truck driver, you could drink Friday night, Saturday night, and go to work Monday and be fine, potentially, right? And even if you're tested, it'll be out of your system because your body metabolizes it in a very rapid fashion. But marijuana stays in your system for so long. That's really one of the complaints with a lot of people who like to use marijuana. It's not going to happen. It's not a sustainable thing that you can use marijuana even periodically and work in an industry like being a trucker or a professional athlete or high school athlete or whatever it is, where they test. Right. So one of the things I'd want to try to figure out is, what is his stage of change? Where's he at with that? And then of course, like on some of these prior videos, I've talked about, there's multiple critical factors that are play a role in people having success at positive behavioral, cognitive, emotional, and even paradigmatic change. But two of the primary critical factors are awareness and motivation. So if for some reason he's not aware of what's happening in his mind, body, and surroundings, and got caught slipping somehow by somebody giving him a brownie and didn't know weed was in it, there's that type of thing, or a cookie or something. But then there's the motivation. How motivated are you? Now, if to jeopardize his whole high school and potentially college and professional career just to smoke marijuana, that's where we weigh out priorities. Now, a lot of people enjoy smoking marijuana or report having psychological or physiological benefits, but everything in life is a compromise that needs to be weighed out. So for me, if I don't smoke marijuana at this point in my life, but if it was such that smoking marijuana would jeopardize my career, I would not smoke marijuana. Unless you work at like Jack in the Box and you're like, I don't care.
Right. And see, his situation is one that he's on a scholarship, and this jeopardizes his scholarship. And he's also in a setting where it's 2022 and marijuana in California is legalized. So there's a lot of other students, not necessarily football players, but other students that he interacts with on the daily basis that are still using, and it's all around him. And I know he struggles with that. He's still, I would say, pre-contemplative, because of the fact that he doesn't see anything really wrong with it. Why can't I? He understands that the NCAA has their own rules and regulations and the players have to, but he still struggles with that.
Well,
And
this is the thing, bro. It's like if someone goes to rehab and they have a problem with heroin,
Right.
and when they get to rehab, they say, well, you can't smoke marijuana or drink alcohol while you're in rehab. And if the person says that's no problem, I don't really care about marijuana and alcohol, though I use them periodically, I just want to get off heroin. That's one thing, right? But if they get all plexed up and I can't smoke weed, why? It's legal. When you're in certain situations, if you're not allowed to use alcohol or marijuana, that's the stipulation. And so he knows the whole thing of whether it's fair or not takes a backseat to the consequences.
yes.
And so if marijuana was not that important to him, he would say, well, I'm going to put it on hold to another point in life. Now the thing is, yeah, there's peer pressure. As an alcoholic in recovery, there's bars everywhere, there's liquor stores everywhere. It's one of the hardest drugs to quit because it's so accessible. At least as a heroin addict, once I get out of the game and into recovery and I'm no longer hanging around with lower companions, I'd really have to go out of my way to get heroin. So it makes it much easier not to use it. But alcohol and marijuana are so easily accessible. But if your motivation to not use has to do with availability, you're at a real disadvantage. So we also talked about motivation, not so much in terms of level of motivation, but the sources. There's intrinsic motivation and there's extrinsic motivation. Intrinsic is internal. Hey man, I'm sick and tired of being sick and tired. I'm sick of that incomprehensible demoralization. I don't want to be high anymore. It drags me down. I don't want to be addicted. That type of motivation tends to bring about better results than, oh, well, I'm doing it for my family, or I'm doing it for the courts, or I'm doing it because I'm on the team.
Right.
But this guy has so much to lose. It really makes me, this is really the first order of business I would explore with him. You have so much on the table. It's not the first time. You knew you had a lot to lose. That they were going to potentially randomly test you at any interval. Hopefully he's smart enough or has enough knowledge to know that if he smoked weed and does it once a month, it's going to stay in his system and he's going to test dirty or positive. So that's really where I go with him. Is this like a self-sabotage that you want to stop playing sports and you're done with it and you're just doing it for outside forces, but you really want to go a different direction? Like, I'd really just explore with him, get into some soul searching and let him discover what are his priorities.
Right.
So in terms of the mind construction, the DRAP model aspects of it is behavior, thoughts, feelings, core beliefs. So the behavior we know has high risks because of the potential outcomes. You'd want to get into what is his thought process about it. What is the emotional aspect of it? Yeah, he might use it to regulate his emotions, but there could be other ways to go. So maybe he could benefit from an antidepressant that is not against the rules that can help him regulate his emotions if he has some sort of condition like PTSD or generalized anxiety disorder or clinical depression or anger issues or whatever it is. And then we want to look at what are his core beliefs. I remember growing up, my belief was, hey, if I feel something is not wrong, even if it's against the law, I'm still going to do it and I'll deal with the consequences. Now I look back and see that that's a very juvenile and immature mindset to have, because then you only find out it's a luck of the draw. And then if you get the negative outcomes, we can't, complain too hard about it because we were putting ourselves at risk. So, but after, that component of the behavior, thoughts, feelings, and core beliefs, once again, we want to pull back and look at the biopsychosocial spiritual model and try to get an understanding. Now, there's psychological aspects to him smoking weed. You kind of mentioned some of the social aspects. Spiritually, it's something that you could look into, but the biological factor is that it's going to stay in your system. So what are all the different benefits? So then, like I said, it goes into the critical factors and the primary critical factors. And awareness and motivation. So either he has lower awareness and or low motivation. Now, the three levels of mind construction, level one has to do with emotional regulation. And so if he's saying that the marijuana helps me regulate my emotions, then that's where you could try to find some alternatives to help him regulate his emotions psychologically, even maybe medicinally. Level two of mind construction has to do with cognitive distortions, thinking errors, and see what kind of, like he might have this sense of entitlement. A lot of athletes, if they're
Yes,
superior athletes, they've been given carte blanche since they were young, and kind of a sense of, well, I can slip through the cracks.
right.
It doesn't matter if I get poor grades because they'll change them for me or whatever the case is. I mean, not to blast on athletes, but sometimes they get special privileges from such an early point in life. You feel you get a sense of like affluenza, like I'm impermeable to the consequences. And then this becomes a reality test and kind of a shock that no, you are going to be held accountable. But then when we get into level three of mind construction is really where we're looking, or mind reconstruction, our core beliefs. What are his core beliefs? And we all have some functional and adaptive and productive core beliefs, but we also have some dysfunctional, maladaptive, or counterproductive core beliefs. And that's really the crux of the issue, is located in our core beliefs, which once again are in the basement of our mind. And to be able to ascertain what those are, there's a few different ways, but that's part of the therapeutic process too. So that's really how you would implement mind construction in this case, from my perspective.
Okay. Um, Techniques to get to the core beliefs. Like we're substituting, like he's an athlete, so I use physical activity and I do a lot of breathing exercises with him because it keeps him present. It keeps him mindful of where he's at. And that's one of the things that I've stressed with him is the fact to stay in the moment, to stay present and not live in his past or his future. But to get to, like you were saying, I think that's what's got to happen with him, because there was a lot of different things that you mentioned just now that I see in him. He has been a superior athlete his whole life. He is on scholarship. For good, bad, or indifferent, he has been treated. That is his identity. He's an athlete. He's a football guy. And that's all he's known. So he has to live up to that. There's also a great amount of pressure that goes with that responsibility. And I think up to this point in high school, it was much different. In college, now there's guys that are just as good, if not better. And I think he struggles with that part of it. And like you said, I got to find out, I got to get to the core of it. Does he really want to do this? Is this really what he wants to do? Because what he says sometimes doesn't match the actions that are placed. He's a sharp guy. He's smart. He's one of those guys that's almost too smart for his own good. And he's been able to get through. But at the bottom of all this, he's a good person and he means well. It's just, how do we get to that point of his core beliefs? What are his core beliefs?
Well,
Is it a direct thing or?
the whole thing about meaning well, like when I was a kid, my dad taught me the road to hell is paved with good intentions.
Right.
So oftentimes good intentions are not good enough to be able to bring about the best outcomes.
Right.
And the thing is that now another thing that comes to mind, being a football player, as you know, these guys tend to get hit a lot and get a lot of concussions. And there might be some lapses in his judgment due to traumatic brain injury. That is something that you would want to take a look at. But really, I think getting into the whole thing of why are you making the decision to smoke marijuana when you know it's a stipulation of the agreement for you to continue to be playing, and you know it's so high risk for you to get busted, and now it's throwing a monkey wrench in your whole flow. So it's really trying to look at, is it due to lower awareness, and has his ability to to reflect on the potential outcomes of a behavior got so low because of hits and TBI? Or does he just say, I'll deal with that later? I mean, is he addicted to marijuana? Like, I mean,
Yeah.
you know what I'm saying?
There's
Usually,
possibility of that. And I think he does a lot of rationalization and minimalizing. Well, it's
Yeah.
not that big of a deal. Well, when it comes into play like this, it's just like for somebody that drank and got DUIs. Okay, it's no different. That person can't drink anymore. It's almost it's caused too much grief in their life when what it does to you outweighs what it does for you. And he's not understanding that fully yet with regards to that person can, but right now, and like you said earlier, maybe later in life you'll be able to revisit it. But at this point, if you want to move forward with because he's getting a great education and he's getting it for free, and and he's getting to play football at one of the best colleges, at least on the West Coast. So there's a lot at stake here.
yeah. So I think really being able to get to what are the primary factors that play a role in him continuing to engage in a behavior that has such devastating consequences. And then also there's that old expression that when the pain of staying the same is greater than the fear of change, we make some changes. So, it seems like these consequences are now becoming painful. And is marijuana that important to him? And this is a real tipping point. So I see really just being able to address these things in a very pragmatic, non-judgmental, motivational interviewing strategy technique format, and saying, it's your life, you're going to do what you want, but what do you want out of life? And everything is give and take. It's like we have the Statue of Liberty on the East Coast, but we know that the only way to have freedoms is to act in a responsible fashion, because people who just want to be buck wild and free and not be responsible end up with the least amount of freedom, usually locked up in the shoe, solitary confinement. And so people who are responsible then get snippets of freedom and liberty. So in the times that they are able to have the opportunity to do what they want to do, they're able to because they already did what they had to do. And so it's that type of thing too. And so really just weighing it out with him and helping him to, because also being a young man, his development, I mean, I'm sure he looks like an adult being an athlete and all that, but he hasn't fully developed into his complete cognitive development. Now that might have been stunted by marijuana and or concussions from getting hit and other factors. Who knows what else he's been through, but he's definitely not exercising the most mature judgment. And I think that's the thing to explore with him in a way that's not lecturing him, getting down on him, or, where he's going to want to get defensive. Be like, man, I'm on your team. What outcome is most important to you? What do you really want? And let's look at the steps that are required to get this outcome.
Right. No, that's great. That's great advice. I mean, that's the approach that I'll take going forward with them. Because a lot of it's just self-awareness. A lot of it is just self-awareness. And I think that's a good avenue to use to help him find out a little bit more about himself. Because his life is going very fast, meaning the good thing is he has a good frame. His days are framed where he's staying busy, which is I see that as a positive. But that also plays into, hey man, I'm totally stressed out. And when I get to my room, all I want to do is unwind and relax.
Right.
And then
that's where we've got to help him develop some more healthy alternatives to defragging, de-stressing, constructive use of leisure time. Yeah, it's good that he's in a controlled environment with structure in terms of reeling him into a bit, but that can be so confining. You just want to have little snippets of freedom here and there, but there's got to be other ways besides using marijuana that he can get that defrag, whether it's video games, working out, watching movies, whatever it is, the breathing exercises that you're bringing to him, poetry, art, making music, listening to music, dancing, a million things, golfing, whatever it is. But marijuana, given his situation right now, is not in his best interest if he wants to continue going the direction he's going and having the benefits of this education and the ability to continue playing as an athlete. The other thing is, I would think, I've never really been an athlete in the traditional sense, like other than like California sports. I can't see marijuana use being really helpful in helping you as an athlete in terms of performance, quickness on your feet, and the ability to just move and think quickly. Because when you're an athlete, when you're a football player, you've got to, your brain has to be able to work. You've got to be able to think rapidly. So that's probably where some denial comes in, but this cannot be adding to his game, bro.
No, I agree.
But hey, brother, I really appreciate you bringing
Thank
this
you.
for sure, bro. And
Yeah.
unfortunately, we've got to check out right now, man, but I really
Okay.
appreciate you bringing this
Yeah,
to the
thank you,
table.
Dr. Ritchie. I appreciate your insight and I will definitely use it going forward. But I'll probably be asking you more and more questions going forward too, if that's all right.
That's great, bro. Maybe
Thank
we
you.
can continue to see how this case unfolds, and hopefully this young man will have success, brother. But once again, I appreciate you being willing to do this,
Thank
because
you.
I'm sure even though this is just a discussion with you and I'm really hopeful that it would be helpful to others out there, because there's millions of other people dealing with parallel situations, whether it's coaches, parents, kids, athletes, and even with struggling with other behaviors. So my goal is that these videos can be of service to people out there in society. So I thank you for bringing this to the table, bro.
Thank you. Yeah, thank
Okay,
you.
it's good to see you, John.
Good
We'll
to
talk
see you,
soon.
Dr. Ritchie. All right, thank you.
Okay, brother.
All right, bye.